This is the second section of the physical exam lecture, beginning with body mechanics. And this particular portion of the chapter, we focus on ourselves a good bit, and it's very important that we do that. We don't use proper body mechanics, we can easily get ourselves hurt, and that's not going to help anybody at all, especially ourselves, but our physicians, our patients. Nobody's going to be benefited. So what are some ways that we can practice safe body mechanics, and what does it mean to have good, proper body mechanics? So basically, you're utilizing all of the correct muscles in order to move around, move objects from one place to another, sit at your desk, stand. Basically, everything that you do, there's different parts of body mechanics that we do to ensure safety. So what do we do a lot of? Well, we do a lot of standing and walking. Some medical assistants actually do a good bit of sitting. We do some lifting. Depending on what kind of practice you're in, you might do less lifting than others. But helping position patients on the exam table, transferring those patients from a wheelchair to maybe a chair or even the exam table, or you may even be involved in helping a patient transition from a wheelchair or a stretcher to another area. So we've got to realize using proper body mechanics is just going to be helpful for everybody. So in your chapter, it tells you that the primary benefits of proper body mechanics includes these things here. It allows the individual to conserve energy, which it takes in order to perform your task. It protects your body from injury by reducing stress on your muscles and your tendons and ligaments and joints and soft tissues. Helps us to maintain proper body control and balance, and Lord, we need help with that. And it also helps to promote safe, efficient, and safe movement. So what we're looking at mainly is to prevent musculoskeletal strains. And one of the most common ones to injure is, of course, your back. Just be careful. The textbook here goes through several things that we can do in order to practice proper body mechanics. And I'm just going to hit on a few of these main ones that we will see pose a little opportunity for us here in the doctor's office, or even if you're out in the hospital working a little bit. One thing as far as the principles that are listed is if you have a patient that is in your office and you're attempting to assist them from the exam table or maybe a chair or a wheelchair, and they become dizzy or they act like they're going to faint and they start to fall. The big thing you need to remember is don't try to hold the patient in that upright position. What you need to do is to try to balance yourself with your legs a little apart, not very wide, but just a little bit apart, like your shoulder width of your shoulders, and that will help you get a good base in order to support yourself. And then gently you're going to gradually lower them to either the chair or the floor. But the big things you need to remember is you don't want to try to catch that patient or hold them up by yourself. Just try to assist them to a safe area that they'll be safe. Okay? So lifting, again, I said lifting was one of the things that we're going to be doing a lot of. Make sure you follow those steps, and there's some nice little videos and pictures here in your textbook that show you how to do proper body mechanics, and they have some good pictures there. Show you the redhead picking up a box. Big thing is to lift with your quads and not with your back. Push instead of pull. Those are some big ones that stick out in my mind that I've heard for years and years, and I've also tried to instill in everybody. Try to push instead of pull, lift with your legs, because your legs are a whole lot stronger than bending at your waist. Alright, so let's move on to where we're talking about in the textbook with positioning and draping your patients. So we've moved from body mechanics for ourselves, and now we're back to the patient. So why do we need to drape our patients? I mean, it's important. You surely don't want to sit in a gown without a drape, and I'm sure our patients definitely appreciate that respect as well. But even in your textbook, it says that the patient's draped during positioning to provide for modesty, comfort, and warmth. And most of the time when you get down to maybe your underwear or even everything off, that you start feeling the coldness of the office and you need something to cover up with. So most of the time your office is going to have the cloth type of drapes. Occasionally they will have paper drapes rather, if you start running out due to a laundry issue. But you definitely want to keep your patients covered up. They appreciate that and respect it, because you're trying to be modest, or keep their modesty in mind. So we're going to move into some of the different positions that a patient might be placed in. And as you can see here in your textbook, there are several different procedures that go through the positioning of the patient. There's the sitting position, the supine position. Remember, if they're in the supine, they're laying on their spine. They're in the prone position. If some of you have taken me for terminology, remember, if you're in the prone position, you're prone to be shot. If you're in the Amityville Horror movie, you've got the dorsal recumbent position, lithotomy, Sims position, the knee chest position, the Fowler position. So these are all going to be some that we go through. You need to be mindful as to what these positions are and why you would actually put the patient in that particular position for an exam. What kind of exam are you going to do? So let's start out with the sitting position. Essentially, the patient's sitting on the side of the bed. Their legs are at 90 degrees on the edge of the table. They're sitting up. We're definitely going to be using this type of exam to examine the head, neck, chest, and upper extremities, and even what we're doing as far as measuring vital signs. Then we move into the, let me go through all these, sorry, in the supine position. In the supine position, the patient is, remember, laying on their spine, and typically we're going to use this to examine the head, chest, abdomen, and extremities. We use this a lot in our orthopedics, and also when you're doing a physical exam, like a general physical exam, for the physician to examine the breast tissues or the abdominal tissues. So this is going to be used to examine the head, chest, abdomen, and extremities. Then looking at the prone position, your patient is laying on their stomach with their back facing up. This one is used to examine the back and maybe even to look at the hip joints to see how far the patient can extend the leg for the hip. That's going to be the best one, best way to describe that one. And let's see here. I kind of went around some of these slides, sorry about that. The dorsal recumbent position, this is actually used for vaginal and rectal exams. We also use that for insertion of urinary catheters. It can be used to examine the head, neck, chest, and extremities. And this is for people who are having difficulty in that supine position. But the biggest thing that you see with this is the patient's legs are bending into a position such as having a vaginal exam, but there are no stirrups being used. Whereas with the lithotomy position, this is the one that we use for vaginal exams for OBGYN, and we're actually able to use the stirrups to help secure the patient's legs. This is also used for different types of pelvic exams. Even in the urinary practice, we can assess the genitalia when the patient is in this exact position. Okay, we can also assess rectal issues while the patient's in this position. Looking over at the Sims position, this patient is basically laying on their side and stomach with one leg propped up, but this is also known as the left lateral position, and basically we use this to examine the vagina and rectum. We measure rectal temperature with the patient in this way, but the most popular reason why patients would be in this position would be for a flex sigmoidoscopy or to administer a enema. Okay. Moving into the knee-chest position. This position is used to examine the rectum, maybe to do some proctoscopy and remove foreign bodies that are in the rectum. The Fowler's position is used to examine the upper body parts of the patient, and typically those patients going in for cardiovascular and respiratory physician offices, they're going to be in this type of position, and this will help those patients breathe better if they are COPD or emphysema patients, CHF, any of those that they breathe better in more of the orthopnic position. Okay, and typically if we have patients that tell us they are going to pass out when we draw their blood, you can draw their blood in the Fowler's position, or they can be in the supine position. Okay.